Good morning and welcome to this edition of San Diego People. I'm Sandra Moss. Skin cancer. It's a type of cancer we all know about, but often don't consider as dangerous as other types of cancer. And that is a mistake. Melanoma, a potentially deadly type of skin cancer, is one of the fastest growing cancers in the country. Today, it's estimated 800,000 Americans are living with a history of malignant melanoma. May is Skin Cancer Awareness Month, and here in sunny San Diego, we all have more control over some of the risk factors than you might think. Today, we've assembled experts in the fight against melanoma and other skin cancers, and we begin this morning with Dr. Melanie Palm, founder of Art of Skin, MD. Thanks for being here.
Thank you for the invite.
You know, I was reading some of the statistics, and I found that 1 in 5 Americans will eventually develop some type of skin cancer. And just reading about the incidence of it, it's a little frightening.
It's staggering, isn't it? Because I think when you think of cancer, you think of breast cancer and colon cancer. But in actuality, skin cancer, which is our largest organ, is what's going to affect nearly 20% of us. And actually, the incidence is on the rise. And so May is Skin Cancer Prevention Month and Awareness Month. We want to talk about that. And then we also wanted to bring to light some statistics on melanoma, because that's the one we as dermatologists and oncologists, as you'll find in a future segment, really get concerned about, because early detection is so key, because it's curable at that point.
Well, let's talk about the risk factors. We all know to stay out of the sun. Not everybody follows that advice, but you know, tanning booths, being out on the beach, just exposure to the ultraviolet rays, is that the greatest risk?
Well, the greatest risk is a personal history and then a family history of having a skin cancer, in particular with melanoma. And then looking at the two of us, we are poster children for developing something like melanoma. Having light eyes, light skin color, a light skin type, having a history of freckling, or having a history of sunburn. So if you've had more than 5 sunburns in your life, it doubles your risk of actually developing melanoma during your lifetime. In addition to that, having a lot of moles, and moles that are funny looking, things that we call dysplastic nevi, that just means funny looking moles, really increases your risk. If you have more than 100 of them on your body, I actually advocate that those patients of mine are seen by me every 6 months for a full skin exam, so we're monitoring them over time.
We have some photographs of moles, and I know most people have probably seen similar pictures to kind of give you an idea of what looks harmless, benign, and what could be a cancerous mole. Could you explain what we're seeing here?
Yeah, and so if you take a look at the photo that's on the left, that's something that's symmetric. It's relatively one color. The border, you can actually delineate where that is. It's relatively small, and if you ask the patient, it probably hasn't changed over time. The one on the right is when we talk to patients about ABCDEs, of changing spots or changing moles. So it's got an asymmetric border. If you were to cut that in one half doesn't match the other one. The border's irregular. As you can see, it almost looks like a fried egg or something. The color, if there's more than several colors, or colors I don't like, black, blue, white, or new red can be a problem. Larger diameter, so if it's bigger than 6 millimeters, which is about the end of a pencil eraser hub, or E is really what I stress to patients as being sort of the most important factor, evolving. So if you find from a patient that something is new, something is changing, that means itching, burning, crusting, bleeding, just something that doesn't seem right. Or even more important, it's just the ugly duckling spot on you. It's the one that doesn't match the rest of your spots and the rest of your moles. That should really signal to you that you should get checked out by a board-certified dermatologist.
Now look at this one. Those other pictures, obviously, those scream that something is wrong. But, I mean, looking at these, I would never know that the one on the right there is malignant.
And that's what I think is important, that you're really good at home about checking yourself once a month. I really, really stress to patients the importance of a self-examination, checking yourself from head all the way to your toes, in between toes, in your mouth, because that's one that's changed over time and otherwise might not be caught, like you said.
And what about early detection, obviously, is important, as you just mentioned. You talked about the risk factors, but what about prevention? Is there really anything that you can do besides staying out of the sun to decrease your risk?
Yeah, good sunscreen use. So, you know, I think we probably as dermatologists talk about that till we're blue in the face, but using a good broadband spectrum, meaning covering UVA, which we know can be related to melanoma development, development, UVB exposure, an SPF of 30 that gives good coverage against the UVB, reapplying, staying out of the sun during peak hours between 10 and 4. If you are, very rigorous activity or water activities, you need to reapply every 90 minutes. But prevention really starts with self-skin examinations at home and seeing your dermatologist to make sure that they're doing a really thorough skin exam as well.
And what about genes? What role do genes play when it comes to getting a deadly cancer like melanoma?
Sure. With melanoma, it's actually a minority. So we know that about 86% of melanomas are related to UV exposure, which means it's completely preventable if we're really watching our exposure to our sun over our lifetime. We also know, and there's good clinical studies that have come out recently in the medical literature, that UV tanning beds are absolutely correlated with melanoma.
Tanning
development.
beds?
Yes. So you really need to stay away from that. I know we live in a sunny climate, and I tell patients, I want you to live and enjoy sunny San Diego, but I want you to do it responsibly.
Something that changed my world is the artificial tanner, the lotion you can buy. You don't have to be pasty white all year round and expose yourself to those UVA rays.
Yeah, so I tell patients, embrace the skin you're in, but we all like to have a little bit of glow sometimes for a special occasion, and those are a great way. They're temporizing. They basically just stain the top layer of the skin. They're relatively non-toxic, so they're a very safe alternative rather than getting sunshine and tanning the old-fashioned way.
Right, but still use your sunscreen on top of that.
Absolutely.
So at the beginning of this program, we mentioned that melanoma is one of the fastest growing cancers in the country. Why is that?
Well, I think we're also detecting it a little bit earlier. There is so much public education still to be done, but we are getting the word out, and we're now finding thinner and thinner melanoma. So I think some of it's early detection, but I also think there's habits that we're not sort of following. So, the fact that we have weekend warriors, people that are getting sunburns, people that are still going into tanning booths and exposing themselves to UV light, we're seeing more cases as a result of that as well.
Mm-hmm. And are women, men, who's more at risk?
Sure. So it's women under age 39 are some of the highest risk groups, but interestingly, men have some of the highest mortality. So next to liver cancer and esophageal cancer, it's got the highest mortality, third highest mortality, melanoma. So it's something we really need to educate both men and women about what to look for and how to prevent it.
All right, we're going to talk about some of the treatments. We're also going to meet a melanoma patient in just a few minutes, and you're going to continue to talk with us as well. The Institute for Melanoma Research and Education, the director is going to join us, along with a survivor, to share his journey from robust, healthy, tanned man to fighting for his life against melanoma. Stay with us.